Good day, everyone, and we are the Group 1. In this activity, we'll be presenting our narrative discussion in the form of a presentation. This includes the case summary, the health models and determinants involved, our analysis using theoretical concepts, the proposed nursing interventions, and its connection to public health realities in the Philippines. For our objectives, this activity aims to reinforce our understanding of health models and determinants of health, recognize the role of social determinants in influencing health, analyze a real life inspired family health scenario, and lastly, present our group insights in a creative and meaningful way.
Now, let's proceed to the summarized case scenario. Maria Soriano is a 47-year-old widow from Barangay Bagoong Silang, Quezon City. She supports her two teenage children by working as a street vendor from morning until late evening. Despite being hardworking and well-loved in her community, Maria overextends herself even when sick. For 5 months, she has suffered recurring headaches, chest heaviness, and fatigue, but she attributes these symptoms to tiredness. A barangay health worker found her blood pressure to be 170 over 100. Yet Maria refused further checkups or maintenance medication due to cost concerns and fear of side effects. She believes she is still healthy, as long as she can cook and sell food. Her children are worried, but she asks them to focus on school instead of her condition.
So now let's move on to our discussion guide. So first question, what model of health does Maria follow and how does it shape her health decisions? Maria follows the functional model of health where she believes that as long as she can work and care for her children, she is still healthy. This shape her decisions by ignoring her symptoms and refusing treatment, since she only considers herself sick if she is bedridden or unable to function. For the second question, how do her biological condition and economic status interplay in her view of being healthy? Her uncontrolled hypertension shows that biologically she is unwell, but her economic struggles as a street vendor and single mother push her to prioritize work and her children's need over her health. Poverty reinforces her belief that being productive is the same as being healthy, even while she risks serious complications. Now, for the last question, as a nurse, how would you respectfully introduce a preventive health mindset without dismissing her lived experience? As a nurse, it is important to acknowledge her sacrifices and respect her view of health. At the same time, I would explain that hypertension is a silent killer and encourage preventive care through low cost lifestyle changes and access to free government health programs. By showing that caring for her health ensures she can continue caring for her family, she may accept a preventive mindset without feeling dismissed. And that ends the discussion guide. Next is identity relevant models of health and determinant involved.
Maria thinks being healthy means she can still work and take care of her kids. This is called the functional model of health. For her, as long as she can cook, sell food, and provide for her family, she believes that she is healthy, even she already has high blood pressure. That is why she doesn't go for checkups or take medicines because she thinks that health only means being strong enough to do daily tasks.
But health is also affected by many things called determinants of health. First is biological. Maria is 47 years old, a woman, and has a higher chance of getting hypertension. She already feels tired and has high blood pressure. Another determinant is behavioral. She skips meals to save money, refuses medicine because of fear and cost, and works too much even when sick. Another is social environment. She is a widow and the only provider for her children. She sacrifices her own health because her priority is her kids. Money problems make her set aside her health needs. Next is physical environment. She works outside every day as a street vendor. She is exposed to pollution, heat, and stress. She also has limited access to healthy food. The last determinant is policies or interventions. There are health centers and workers available, but she doesn't use them much because of cost, mistrust, and fear of medicine side effects. She also doesn't have health insurance or enough social support.
Maria Soriano's perspective reflects the functional model of health. a theoretical concept wherein health is equated with the ability to fulfill one's roles and responsibilities. Despite experiencing fatigue, headache, and an elevated blood pressure of 170 over 100 mmHg. Maria considers herself healthy as long as she can cook and sell food for her family. This illustrates how the concept of health influences decisions, leading her to delay treatment and refuse maintenance medications, according to Taylor, Lean, and Bartlett, 2019. The case also demonstrates the concept of person, which nursing defines as a holistic being composed of physical, emotional, social, and spiritual dimensions. Maria's choices are shaped not only by her biological condition, but also by her role as a widow and sole provider to her children. This is closely linked with the environment concept, as her financial limitations and daily struggles in Barangay Bagong Silang directly affect her health behaviors.
As a nurse, caring means showing compassion, educating, and supporting patients. For Maria, this means respecting her sacrifices while guiding her to prevent care like blood pressure checks, affordable clinic visits, and healthy lifestyle changes so she can stay strong for her children.
This nursing care plan emphasizes the importance of independent, dependent, and collaborative interventions in the management of hypertension. For the independent interventions, the nurse provides culturally appropriate health education to strengthen the patient's understanding of hypertension and its long-term risk. By correcting misconceptions and fears about maintenance educations, the nurse reduces anxiety and promotes adherence, which is essential for controlling blood pressure. Lastly, stress management techniques such as deep breathing, relaxation exercises, and short breaks are also taught, as these help regulate the body's response to stress and prevent further elevation of blood pressure. Meanwhile, the dependent intervention involves referral to a physician for proper evaluation and prescription of antihypertensive drugs. This step ensures that the patient receives the correct medication and dosage based on their clinical status. Physician management combined with continuous nursing support helps achieve better blood pressure control and lowers the risk of complications like heart disease, stroke, and kidney damage.
Another dependent nursing intervention is administer prescribed antihypertensive medications and monitor for therapeutic and adverse effects. So this is to control blood pressure and prevent complications while ensuring safety. And also monitor blood pressure regularly and record findings. So this is to provide objective data to evaluate the effectiveness of treatment. And last is the collaborative nursing interventions, which is the work with barangay health workers for home visits and BP monitoring. So this is to ensure continuity of care and consistent follow-up at the community level. And also collaborate with the physician for periodic checkups, medication adjustments, and further diagnostic tests if needed. So this is to ensure Maria's hypertension is managed safely and effectively under professional supervision.
For this part, we reflect on how this case relates to Philippine public health realities. This case mirrors the everyday realities of public health in the Philippines. Maria's experience is not isolated. It represents the struggles of many Filipinos who face poverty, lack of affordable healthcare, and cultural beliefs that shape their understanding of health. For many, being healthy simply means being strong enough to continue working rather than being free from disease. Research also shows that instead of going straight to doctors, people often resort to self-care practices like endurance, home remedies, seeking the help of a manghihilot before consulting medical professionals.
In the Philippines, health isn't just about treating illness. It's also about breaking down the social and economic barriers that prevent people from getting care. As Tejero et al. Point out, low health literacy and financial struggles often lead families to delay or skip preventive care. With high out-of-pocket costs for medicine and treatment, many are left with difficult choices. That's why nurses and health workers play a vital role, not just in providing care, but in doing so with compassion, cultural understanding, and respect for each person's reality.
And that ends our group presentation. Through this activity, we were able to apply theoretical concepts in analyzing real-life health situations and propose appropriate interventions. We hope our discussion gave you a clear understanding of the case and its relevance to public health in the Philippines. Thank you for your time and attention.